Hi, friends, and welcome back to Holistically Well. Today's episode is a quick but impactful dive into a hormone that simply doesn't always get the attention it deserves proactively. That is progesterone. Now, whether you're trying to conceive, navigating irregular cycles, struggling to maintain pregnancy, or just noticing that your body feels off hormonally, then this episode is for you. We are going to cover what progesterone actually does, why you might be low, and the most supportive natural ways to boost it without synthetic hormones or guesswork. Now, it is very important to note that progesterone supplementation during pregnancy can be a key and absolutely vital supplementation for women experiencing recurrent miscarriage or low progesterone production. And so, when I am talking about natural ways to boost our progesterone, if you are already pregnant, please continue taking your supplementation, because at that point, it is too late to boost levels naturally through the arenas that we're going to discuss today. You want to make sure you're getting the extra supplementation. So, synthetic hormone supplementation, specifically of progesterone, absolutely has its time and place and can be absolutely vital to maintaining pregnancy, especially in women with the MTHFR gene. Today, we are talking about how to proactively produce progesterone. This is a question that was recently dropped in my Q&A, which I do Monday a month, I would say. I used to do it most Mondays, but since I've started the podcast and I've done a lot of deep dives into the questions on here, we are usually doing monthly Monday Q&As. And I love pulling questions that you all ask and creating a full episode about it, because some of these topics deserve a deeper dive. And so the question that I was asked was how to increase progesterone naturally. And that is exactly what we are diving into today. Because if you are somebody who struggles with low progesterone, proactively doing what we are talking about today will help boost those levels naturally and may make you not need additional supplementation during pregnancy or the other life seasons that we'll chat about as we move through. So, why does progesterone matter anyway? Let's start with the why. Now, progesterone is produced after ovulation and is critical for supporting conception and pregnancy. Progesterone, progestation. Remember that. Progesterone is also very important for keeping your cycles regular. So let's say you ovulate, sperm did not fertilize that egg. Well, we need progesterone at certain levels to keep that cycle regular so that we shed that lining and then move on to that next bleeding phase, right? If we fertilize our egg, if sperm fertilizes your egg and that fertilized egg implants into your uterine lining, then our progesterone levels will boost and support the maintaining of your pregnancy. Now, progesterone is also very important for calming your nervous system. So if you are somebody who really struggles with PMS irritability, those progesterone levels may be off. Progesterone is also very helpful in deep sleep and just feeling calm and stable and not on edge. And so we see the effects of this reproductive hormone really across the board and not only during pregnancy itself. So if you're low, you may experiencing spotting before your actual period. Your luteal phase may be shorter than 10 days. You may notice poor sleep, anxiety, or irritability. Hello, PMS symptoms. And you may have trouble conceiving or staying pregnant. And this is what I see the most in my office, supporting many women through their childbearing years. If you have had recurrent miscarriage, so 2 or 3 miscarriages, goodness, even if you have 1 miscarriage, please look into progesterone. Most OBGYNs, midwives in the traditional medical setting are not looking into this hormone until after 2 to 3 miscarriages. That is the ACOG, the American College of Gynecologists, recommendation, is to not do deeper dives into understanding why you're having recurrent pregnancy loss until after that number of miscarriages. I proactively asked my gynecologist when I was engaged and ready to embark on marriage and starting a family down the road. And I asked her, what can I proactively do to support my fertility now? And she simply said, when you have 2 to 3 miscarriages, then come back and we can talk about it. And that absolutely fired me up and is what drove me to dive into this work. So please do not take that as an answer if you hear that from your OBGYN or midwife. And know that you can get a hormone panel. You can literally do most walk-in labs and ask for progesterone reading. At our local lab, I think it's about $20. And you can do self-pay. You don't even need a referral. And so having this number checked is widely available. And it is so simple. It's a simple blood test, and we can see where those levels are. Now, it can definitely depend what phase you are in your cycle, and that's why I would certainly recommend working with a functional health practitioner if you're struggling with these things and want greater insight into what your levels are specifically. That is something that you can deep dive into. So understanding first and foremost what you may notice if your progesterone is low, that way you know what to dive into further, right? So spotting before your period, or it could be breakthrough bleeding. You're not having an actual period, but you're spotting, you're bleeding, you're not really sure what that is. It could be due to low progesterone. Your luteal phase, so that portion of your cycle, may be shorter than the typical 10 days. You may notice poor sleep, anxiety, or irritability, trouble conceiving or staying pregnant, and then estrogen dominance symptoms. Estrogen dominance may be characterized by weight gain, significant mood swings, fatigue, and irregular periods. Other common signs include breast tenderness, headaches, and decreased libido. So these symptoms can definitely fluctuate throughout the menstrual cycle and may be more pronounced during perimenopause as progesterone is decreasing and estrogen may be higher, and vice versa. Okay, let's talk about why progesterone might be low. And this is my absolute favorite to dive into because this is where you can start taking some actionable steps. Number one is stress and cortisol dysregulation. So if you are stressed out, this elevates your cortisol. When cortisol is high, your body steals resources from progesterone. It's a survival strategy. If we are in a high stress state, the body is saying, okay, it's not a safe time to conceive. I am not going to increase this progestation, pro-pregnancy hormone, because our body seeks safety over reproduction. It wants to prioritize our needs before getting new life within us, right? So stress and cortisol dysregulation is absolutely huge when it comes to progesterone. If our stress response is high, if our cortisol levels are high, our body will not produce the amount of progesterone needed to optimize our fertility and maintain a pregnancy. So if you're like, yep, that's me, I am always in a high stress state, I invite you to minimize what stressors you can. For me, I was in a very high stress job in the traditional medical field. Thankfully, I was able to conceive still 2 children in that time of my life, but I knew that it was starting to take a toll on me as I was raising my 2 kiddos, being a physical therapist, trying to create homemade food for my family, like all of the things. I was never getting a break. And I started to really notice my cortisol levels raising. And so for me, I made the huge shift to literally quit my job and start my own private practice. And I'm not saying you need to make that big of a change, but look at your life and what's not sustainable. What is not sustainable in your life right now that is a huge stressor that perhaps you can let go of, that you can change? What are you constantly complaining about, but simply not making a change in? And for me, that was my job. And I realized something needed to change, and so I did. For others, it may be your spouse's job. I have a patient who was recently talking to me how her husband is gone for 2 weeks at a time right now, and that is really stressful. And so we talked about, okay, if that's a constant stressor, how do we change that? Or do we know it has a short timeline and it has its purpose that he is doing this job right now? And we can feel better hormonally and in our stress response if we know there's a timeline and there's a plan for him to change once children come along, right? So this is something that you could have an open conversation with your spouse about. What are your biggest life stressors? What things perhaps need to change? And then how can we better manage our response to them so that that progesterone can naturally increase without cortisol suppressing it? Second is low sodium and electrolyte deficiency. Now, sodium is something that got tons of attention in the news over recent years where we were told to decrease our salt intake, right? How often have we heard that? Now, decreasing salt intake when we're talking about simple table salt that you find at a local restaurant, That salt is not great for us, right? That is very demineralized, deionized salt. We want good, optimal quality salt, sea salt, Himalayan salt, um, good mineral rich salt. And so our body actually needs sodium to produce progesterone. Many women eat clean, but their diet is low in processed foods. I am that way, right? I don't eat a lot of processed foods. By extension, my diet is low in salt. Even if I am seasoning my food with salt, I am just not getting enough in to support my body's sodium needs. And so personally, I absolutely love supplementing with the electrolytes by LMNT. This supports adrenal function, which is absolutely needed for progesterone production. So I use and recommend LMNT daily. It is a high quality electrolyte with no extra junk. I'll put a link in the show notes where you can get a free 12-pack of samples with a purchase from them, which is awesome because you can try all of the different flavors. So low sodium or electrolyte deficiency can be something else contributing to progesterone production. Now, again, labs can be really key for this because some women will have their labs read and they'll be really high in sodium. Usually that's if you're getting some fast food in your diet or you're eating a decent amount of processed food still. Then we may want to look at A, just making sure you're getting the right kind of sodium in your diet, and then B, reducing processed foods, and then upping the good quality salt intake. Now, for me personally, I had my labs drawn recently. I am pregnant. I drink a packet of Element a day, which has 1,000 milligrams of sodium in it, and my sodium levels were still low. I was on the low end for sodium specifically. And so I think a lot of people get concerned that, oh, that's really a lot of sodium to put into my body all at once. You need to look at your individual labs, know where you fall out on that spectrum, know where the rest of your diet falls at. But for most people who are active individuals and not eating much processed food at all, you are typically going to be low in sodium, and having some type of supplementation like an Element electrolyte can be absolutely key in supporting your adrenal function and thereby progesterone production. Now, third is nervous system dysregulation. And this certainly ties into the stress response and cortisol, but we're specifically looking at the nervous system here. When the body is in chronic fight or flight mode, this tells your body that it is unsafe to ovulate. No ovulation equals no spike in progesterone. So that natural cycle of the body where we have a monthly ovulation and then a spike in progesterone to support a possible pregnancy, it simply doesn't happen because the body is, again, feeling like it is an unsafe time to conceive. So it is not going to put our body's resources towards producing progesterone. All right. So this very much goes into that first point where if you are living in a high stress state, I invite you to really just reflect on where your life is at right now, how you can reduce those constant stressors. But then here, when we look at nervous system dysregulation, we really want to look at how you react to those stressors. So perhaps it's not a time where you can change the stressor, just like the patient I mentioned whose husband is gone for 2 weeks at a time for work right now. That is a stressor they can't currently change. So then we need to look at how do we better regulate our nervous system so that that stressor is not impacting our body's positioning on feeling safe or unsafe in terms of ovulation. So supporting our nervous system can look like diaphragmatic breathing, nice deep inhales where we're feeling our diaphragm drop, which taps into our vagus nerve and switches us over from our sympathetic nervous system to our parasympathetic, which is the rest and digest portion of our nervous system. Gentle movement can also be absolutely key for supporting our nervous system. I love pairing breath with movement. So movements such as inhaling, reaching your arms overhead, exhaling, forward fold, gently swing side to side, performing cat-cow on your hands and your knees where you inhale and extend and exhale round through the spine. These movements all support our nervous system while also supporting our body physically to move us out of a dysregulated state and into a regulated one. A few other key points that can help with nervous system dysregulation would be dry needling, which can specifically tap into the nerve roots to calm the nervous system directly. Manual therapy or massage, that touch can have a calming effect on our nervous system. And then being out in nature, getting sunlight, that can help our body just feel calm, rooted, and grounded. Getting barefoot in the grass, all of those things can help calm our nervous system. Now, the fourth reason progesterone might be low is circadian rhythm disruption and poor sleep. So, this right away ties into getting outside, getting sunlight on your eyes, getting yourself immersed into nature. Our body needs a natural rhythm, which is our circadian rhythm. And this is that body's natural internal clock telling us it's time to wake up, it's time to be tired, it's time to go to sleep. It helps keep our body on a regular schedule, which supports our hormones, right? And contributes to that environment of feeling safe. So I definitely recommend if you notice that you are staying up way past when the sun sets. So let's say that you're staying up until 11 p.m. or midnight and then sleeping in way past when the sun rises. So let's say you're sleeping in until 8 or 9 a.m. That is telling us that that circadian rhythm is off. Or if your alarm goes off at kind of that sunrise time because you have to get up and go to work and you feel extremely groggy, again, we need to shift that circadian rhythm. And so when that sun sets, you are putting on blue light blockers, you are dimming your lights, you're mimicking your internal environment to be like the outdoors. And so as it starts getting darker outside, I'm making sure that our bright lights inside are not on, right? We're mimicking our internal environment to be that of the outdoors. In the morning, whenever that sun is rising, it's an awesome time to get outside, get some of that morning sunlight on your eyes. It's going to cue to your hormones to boost the appropriate levels to mirror the time it is in the day. And that is going to thus help with that natural production of progesterone as well. And all that to say, sleep quality is extremely important here. That ties right in with our circadian rhythm. We get our deepest sleep prior to midnight. So that 9 p.m. to midnight is a really key time for sleep. And so if you are going back to bed at 11 or 12, or missing some of those key deep sleep hours. And so I definitely implore you to look into your circadian rhythm and making sure you're getting around 8 hours of sleep a night, kind of mimicking that sunrise and sunset. Now, number 5 for disruption of our hormone progesterone would be simply endocrine disruptor exposure. And these would be environmental toxins. Plastics, fragrance, parabens, these all impact hormone production and our ability to detox estrogen. This directly lowers progesterone, okay? So a lot of these plastics, fragrances, parabens, they mimic estrogen in our body. And when they mimic estrogen, it thereby directly lowers our production of progesterone. And so this is why in my preconception course, I have an entire week devoted of the 6 weeks to understanding endocrine disruptors and why toxins are a thing for our hormone health. And then also looking at smart swaps, how to make non-overwhelmed and informed choices to get out the products that are disrupting your estrogen and your progesterone production, and to use products in, on, and around your body that aren't going to disrupt the hormone production in your life, because that is absolutely key when we want to create and maintain new life. All right, so 5 holistic ways to boost progesterone. Number 1, prioritize safety signals. Eat your breakfast within 30 to 60 minutes of waking, keep your blood sugar stable, move gently with your breath, and simply diaphragmatically breathe throughout the day. Number 2, reduce stress strategically. This doesn't mean bubble baths and wine or a trip to the spa. It simply means downshifting your nervous system from this fight or flight upregulated state and instead shifting into our vagus nerve and our parasympathetic portion of our nervous system, which is rest and digest. This includes breath work, gentle mobility, time in nature, morning sunlight, and then tracking your cycle to avoid overexertion during the luteal phase. So I wrote a whole blog post about exercising with your cycle. And while I don't think we need to be extremely strict when it comes to exercising with each particular phase of the cycle, I do think we need to understand that our body's hormone needs ebb and flow throughout the month. And our exercise routine should also ebb and flow. Our body needs different things during different phases of our cycle. So I'll drop the link for that in the show notes as well for you. Now, number 3 for our 5 holistic ways to boost progesterone is to use salt smart. Don't fear salt. Don't fear quality salt, I should say. Add mineral-rich salt to your meals and or use an electrolyte like Element. I do both. I add mineral-rich salt to my meals and I use Element every single day. And again, my sodium levels were still on the low end of what is optimal. And so I'm even doing sometimes 2 packets of Element a day. So if you are in a lower carbohydrate diet, if you are not eating processed foods, if you are breastfeeding, or if you are active, this is especially important for you. Don't fear salt, add mineral-rich salt to your meals, or use Element electrolytes. I'll put the link below for a free 12-pack of samples with your purchase. Number 4 for holistic methods to support progesterone production would be to eliminate endocrine disruptors. I am so passionate about this. This is a change that my now husband and I made when we were engaged, where I just started swapping out things in my makeup bag, in the shower, in home cleaning products to make sure what I was using was supporting my hormones and not disrupting them. And then I started doing the same for my husband once we got married and moved in together, because their testosterone levels are extremely important for conception as well, and also just maintaining healthy life of your children as you're living in that household together. So this is absolutely something that you can get your spouse on board with. I break it down further in my preconception class, where we devote an entire week to really understanding how this impacts your specific hormones, and then what smart swaps to make it so easy for you to do this without overwhelm. And then 5th and final would be sleep and light rhythms. Morning sunlight, consistent bedtime, and dimming lights in the evening to help reset your circadian rhythm and support optimal hormone output. All right, my friend, this is especially important if you're pre-conception and trying to prepare your body to conceive. Pro-gestation, pro-pregnancy, progesterone hormone is key. All right. Now, if you are a year or so postpartum and you are ready to make sure your cycle is regular again, you are thinking to conceive again, this is very important for you to consider. Now, if you are already pregnant, and you know that your levels were low prior, get those levels tested. We want to make sure your progesterone is at the NAPRO chart optimal levels. And then if it's not, we can use supplementation with injection, with an oral substitute, or with a suppository to promote increasing those levels right away, because time is not on our side if you're already pregnant. I will note that it takes 3 to 4 months to notice a shift in your hormones after making these changes. And so that's why I suggest doing so proactively, starting now, no matter what season of life you are in. But if you're already pregnant, to not hesitate to supplement those levels, because we don't have 3 to 4 months to raise those levels once you have already conceived. Okay? Now, inside my Holistically Well preconception program, as I mentioned, I break down exactly how to support your hormones from the inside out, progesterone included. So you can check the link in the show notes if you are in that life season and want an additional 6 weeks of support with me. Now, if this episode helped you, please share it with a friend who is walking through a similar life season. And if you're ready to go deeper, leave a review or reach out on Instagram at Dr. Kayla Borchers. I absolutely love hearing from you. Your body is always working to support you. It wants to give you the proper levels of hormones that you need to absolutely thrive. So let's give it what it needs, without fear and without shame. Talk soon, my friend. I will be right back here every Tuesday with a new episode for you. Hold on a second. Don't go just yet. I've got a special giveaway just for my Holistically Well listeners. Each month, I'll be choosing one winner to receive a free one-on-one session with me, Dr. Kayla. That's a full 60 minutes, virtually or in person, focused entirely on your individualized care with a holistic doctor of physical therapy. To enter, just hit pause, leave a 5-star rating, and share what you're loving about the show. Your feedback helps shape future episodes and helps more women find this space. I can't wait to connect with you.